Welcome to Ultimate Skincare and Beauty Report. I'm Mary Winkenwerder. Personal enhancement procedures are welcomed by many across the world. They hold the promise of an enhanced physical body and heightened self-esteem. Joining us this episode is Dr. Marchelo Ghersi to share with us more about preparing a physical checklist before a plastic surgery procedure. Dr. Ghersi, welcome to Ultimate Skincare and Beauty Report.
Thank you for having me, Mary. Happy to be here.
It's great to have you join us. So, when preparing for plastic surgery, what does one need to keep in mind?
Well, a host of things, really. First and foremost, the patient has to find a doctor that they like. They have to have a consultation with a doctor, and once they decide to book a surgery and have a surgery, then they have to prepare for it. Preparation involves making sure they have enough time away from work or their responsibilities to recover for surgery. They should make sure they have a person or several individuals to take care of them for emotional support, to help them through the post-operative phase. They should make sure that all their medications are in order. They have to go to the pharmacy, get all their medications for after surgery. They need to make sure that their home or the place where they're staying is adequately equipped to accommodate them after surgery, whether that means having their beds or pillows or water or food. For example, sometimes we don't like for our patients to go upstairs after surgery, so sometimes they need to relocate and find a level place where they don't have to go up and down. Basically make sure that they have time to rest and relax after surgery, because that's what a lot of the post-operative recovery entails, just relaxing and letting the body heal.
Sure. So how much detailed research should one conduct before having any type of plastic surgery procedure?
Great question. So we live in a day and age where there's an incredible amount of resources online and elsewhere for patients to go before surgery and educate themselves. And that usually works great. And I say usually because there's a lot of bad information out there. So sometimes we encounter patients that go through too much information, and usually too much bad information, and that kind of confounds their beliefs or their thoughts or the plan of their surgeon. Okay, so I personally believe that patients should definitely do some research. I say some because some is usually enough. I usually tell my patients, leave the detailed stuff to us. And equally important, the resources that they use for information should be the correct resources. I always tell my patients to go to the American Society of Plastic Surgeons website, and that has tons of wonderful information in terms of the actual procedures, instructions, recovery, and all kinds of useful information for before and after surgery.
Fantastic. And so should a family member or a close friend be involved with preparing for this type of major surgery, and at what capacity?
I think that's a wonderful idea. Before surgery, surgery takes a big emotional toll, as you and I spoke in the past. It takes a big emotional toll in addition to obviously the physical toll that it obviously brings about. And it's important for a patient to have emotional support whether that be a husband, a wife, a friend, a son, a daughter, a close friend that can really be with them in preparation, which is an exciting time in preparation of surgery. It's also a scary time because it's always scary to undergo surgery and undergo anesthesia. And after surgery, it's a vulnerable time. We're in pain, we're uncomfortable, and it's important to have someone with us during that period. In what capacity? That depends on the individual, and it's different from person to person. But at the very least, every patient having surgery should have someone ready and at hand to take care of them at least the first couple of days after surgery.
Sure. So when coming home from surgery, what accommodations should your home have?
So that really depends on the type of surgery the patient is having. If it's a small operation, they may not need to do a whole lot. If it's a bigger operation, obviously it's a little more detailed. But the main things are what I said before. They should have a nice, comfortable bed with plenty of pillows, because positioning is usually an issue. Doctors sometimes want their patients to have their head elevated or their legs elevated, so usually pillows and cushions help with that. It should be an easy to get in and out of bed or bedroom, right? So we don't really like patients going upstairs or downstairs or crawling or having to do much physical activity to get to their bed. And plenty of great healthy food, plenty of juices, plenty of water, plenty of soup. We like simple food in the post-operative period. Nothing fried, nothing spicy, nothing too heavy. And that's pretty much it. And a comfortable place. We like nice music, just a nice, relaxing environment.
Wonderful. So Dr. Ghersi, where can we catch up with you and your medical practice online?
Sure. So our practice at Plastic Surgery Institute of Miami has a website, psimiami.com. We're also on Facebook and Twitter, and we usually make it very easy for our patients to reach us using any of those venues.
Fantastic. All right, Dr. Ghersi, thanks so much for joining us. It was great having you on the show.
Thank you for having me, Mary.
All right. Catch up with me on my blog, www.beautereport.com, and on Twitter @BeautyPublicist. Everyone, thanks so much for joining us on Ultimate Skincare and Beauty Report. Have a beautiful and successful week. Mwah.